I'll be honest with you. Writing a detailed senior dog health checklist feels way outside my usual wheelhouse. My name is Mariana Vasquez, and I'm a small pet care specialist. I spend most of my time talking about guinea pig husbandry, behavior, and enrichment. But here's the thing. After years of building incredibly detailed care checklists for my cavies, because trust me, nothing prepares you for the sheer volume of details involved in keeping small pets healthy, I recognize that same need among dog parents watching their companions age. So today, we're diving into a comprehensive senior dog health checklist that'll help you stay organized as your dog enters those golden years. We'll cover veterinary appointments, at-home monitoring, mobility assessments, nutrition, and all the pieces that make comprehensive senior care manageable instead of overwhelming. You're listening to Total Pet Parent Podcast. Quick heads up before we dive in, the research, the data, every word of the script you're about to hear is written and verified by real people, but the voice delivering it is AI generated. I just like being upfront about that. Thanks for tuning in, whether you're a regular listener or this is your first time finding the show. If you're new here, welcome. Glad you're along for the ride. We drop new episodes every Monday, Wednesday, and Friday, covering all corners of pet care. Today, we're tackling a comprehensive senior dog health checklist, everything you need to monitor and manage as your dog enters those golden years. Let's jump right in. Your dog typically transitions into senior status around age 7 to 10, depending on breed size. Giant breeds like Great Danes hit senior territory around 5 or 6. Large breeds like German Shepherds around 7 or 8. Medium breeds like Beagles around 8 to 10. And small breeds like Chihuahuas not until 10 or 11. Larger dogs age faster. It's tied to accelerated cellular aging and higher cancer rates. So when we talk about senior care, we're really talking about the last quarter of your dog's expected lifespan, and that window varies quite a bit. Let's start with the foundation: twice annual veterinary examinations. You'll want to shift from that annual schedule you maintained during your dog's adult years to every 6 months now. Aging dogs experience physiological changes rapidly. Conditions can progress quickly between yearly appointments. Those twice annual check-ins catch organ dysfunction, cancer, and metabolic diseases in earlier, more treatable stages. Here's what those appointments should include. Your veterinarian needs to do a complete physical examination, palpating the abdomen, checking heart and lung sounds with a stethoscope, assessing body condition score, examining lymph nodes for any abnormalities or asymmetry. You'll want comprehensive blood work, a full chemistry panel, and complete blood count. This establishes baseline values for kidney function, that's BUN and creatinine, liver enzymes like ALT, AST, and ALP, blood glucose, and red and white blood cell counts. These are critical for catching organ decline before symptoms appear. Thyroid function testing becomes increasingly important. Hypothyroidism is common in senior dogs, particularly golden retrievers, Dobermans, and Cocker Spaniels. It causes weight gain, lethargy, and coat changes that owners often mistake for just getting old. A urinalysis with sediment examination is simple but powerful. It detects urinary tract infections, kidney disease, diabetes, and bladder stones before your dog shows obvious signs of discomfort or inappropriate urination. Blood pressure measurement matters too. Systemic hypertension affects roughly 10% of senior dogs and can cause organ damage if left undetected and untreated. Your vet should also do a dental evaluation with periodontal charting, assessing each tooth individually for mobility, recession, and periodontal pockets deeper than 3 millimeters, which indicate infection below the gum line requiring professional cleaning under anesthesia. Beyond just weight, your veterinarian should evaluate muscle wasting over the spine, hips, and skull.
That's an early indicator of inadequate protein intake, kidney disease, or chronic pain limiting movement. An eye examination with pupillary light reflex checks for cataracts, nuclear sclerosis, that's normal age-related lens hardening, glaucoma, and progressive retinal atrophy. All of these become more prevalent with age, and early detection preserves remaining vision longer.
I learned with my guinea pigs that twice-yearly vet visits catch problems I'd never notice at home. The slight heart murmur, the early dental spur formation, the subtle weight loss hidden under all that fur. Dogs are even better at hiding discomfort than cavies, making these scheduled check-ins absolutely non-negotiable. Between those veterinary appointments, you need a daily at-home observation routine. Think of it as your early warning system. Small changes compound into patterns that signal trouble. Start with appetite and water consumption tracking. Notice if your dog suddenly becomes pickier, leaves food in the bowl, or drinks significantly more water than usual. Polydipsia, excessive thirst, can indicate diabetes, kidney disease, or Cushing's syndrome. Monitor elimination habits, frequency, volume, color, consistency, and any straining during urination or defecation. Changes often precede formal diagnoses of gastrointestinal, urinary, or prostate issues. Count breaths per minute while your dog sleeps peacefully. Normal is 10 to 30 breaths per minute. Consistently elevated rates above 35 to 40 may indicate heart disease, pain, or respiratory compromise. Watch gait and mobility closely. Look for limping, reluctance to climb stairs, difficulty rising from lying down, bunny hopping on back legs, or decreased willingness to jump into the car, all signs of arthritis or orthopedic pain. Note any behavioral changes and mental alertness shifts, confusion, disorientation, staring at walls, forgetting familiar commands, changes in sleep-wake cycles, or increased anxiety. These are potential indicators of cognitive decline. Run your hands over your dog's entire body daily, feeling for new lumps, bumps, hot spots, thinning coat, excessive dandruff, or areas of tenderness that weren't there before. Reduced activity means slower nail wear, requiring more frequent trimming to prevent overgrowth that alters gait and causes joint stress. Check pads for cracks, cuts, or foreign objects. Lift the lips weekly to look for red, swollen gums, loose teeth, unusual growths, or that unmistakable smell of advanced periodontal disease. It's distinct. Trust me, you'll know it. This daily hands-on time doubles as bonding and quality of life assessment. I do something similar with my guinea pigs during lap time, running my fingers along their spines and bellies while they rumble strut contentedly. With dogs, those daily pets and cuddles become diagnostic opportunities. Now let's talk about specialized geriatric screening tests. Beyond routine wellness exams, your senior dog health checklist should include age-specific screenings that aren't standard for younger adults. These tests catch breed-predisposed conditions early. A cardiac evaluation with chest radiographs reveals heart size. An enlarged heart suggests cardiomyopathy or valve disease. Lung field changes, and early pulmonary edema before your dog shows exercise intolerance or coughing. An abdominal ultrasound examination visualizes organ architecture, detecting masses, cysts, gallbladder sludge, enlarged lymph nodes, and structural changes in the liver, spleen, kidneys, and adrenal glands that blood work alone might miss. Orthopedic evaluation for arthritis includes joint palpation, range of motion testing, and potentially radiographs to document degenerative changes in hips, elbows, knees, those are stifles in dogs, and spine. This is essential for developing appropriate pain management protocols. Your veterinarian may use standardized questionnaires like the Canine Cognitive Dysfunction Rating Scale to objectively measure changes in disorientation, social interactions, sleep patterns, and house training consistency. Even indoor dogs can harbor parasites that tax their immune systems. Senior dogs with compromised immunity need regular fecal testing, even if you're diligent about monthly preventatives. Tick-borne disease panels test for Lyme disease, ehrlichiosis, anaplasmosis, and Rocky Mountain spotted fever. This becomes critical if your dog shows vague symptoms like lethargy, joint pain, or fever. These diseases damage organs over time if untreated. Breed-specific cancer screenings matter too. Golden retrievers benefit from annual splenic ultrasounds because of hemangiosarcoma risk. Bernese mountain dogs need thorough lymph node palpation due to lymphoma prevalence. Boxers require careful monitoring for mast cell tumors. Some of these tests aren't cheap, I won't pretend otherwise, but catching problems early usually costs less than treating advanced disease. That's been my experience with guinea pig care too. Investing in proper diet and housing from day one beats emergency vet visits for preventable conditions. Moving on to nutritional assessment and dietary modifications. Aging changes nutritional needs substantially. Your senior dog health checklist must include regular dietary evaluations with adjustments based on activity level, body condition, and any diagnosed conditions. Most senior dogs need 20 to 30% fewer calories than they did in their prime adult years due to decreased activity and slower metabolism. Continuing the same portions leads to obesity and joint stress. Contrary to old advice about restricting protein, healthy senior dogs actually need more bioavailable protein, around 25 to 32% on a dry matter basis, to maintain muscle mass and immune function. Joint-supporting supplements like glucosamine, typically 500 to 1,500 milligrams depending on size, chondroitin, MSM, and omega-3 fatty acids from fish oil support cartilage health and reduce inflammatory responses in arthritic joints. Senior dogs benefit from easily digestible protein sources like chicken, turkey, or fish rather than complex grains, plus prebiotic fiber and probiotics to support the gut microbiome that often shifts with age. Many senior dogs don't drink enough water, especially those with kidney disease. Switching from dry kibble to wet food or adding water or bone broth to meals increases moisture intake significantly. Dogs with missing teeth, painful periodontal disease, or oral tumors need softened kibble, canned food, or specially formulated senior textures that don't require aggressive chewing. Foods containing medium-chain triglycerides, MCTs, antioxidants like vitamins E and C, omega-3 DHA, and potentially prescription therapeutic diets designed for cognitive dysfunction show measurable benefits in mental clarity. The shift from all life stages food to senior formulations isn't just marketing, though I'll admit I was skeptical at first. The protein-to-fat ratios, calorie density, and added supplements genuinely address age-related changes. It's similar to how my guinea pigs needed Timothy hay instead of alfalfa once they matured. Same species, different life stage, different requirements. Let's focus on mobility and pain management monitoring. Senior dog mobility issues often develop gradually, making them easy to dismiss as slowing down. Your checklist needs objective markers to catch decline early. Time how long it takes your dog to climb a standard flight of stairs, or note if they begin refusing stairs entirely, bunny hopping, or yelping during ascent or descent. Measure seconds from lying position to standing. Healthy seniors should rise smoothly within 3 to 5 seconds, while arthritic dogs often rock forward multiple times or need 10+ seconds to stand. Note whether your dog pants excessively after normal walks, takes longer to recover, or shows next-day stiffness.
Delayed onset soreness indicates overdoing activity for their current condition. Watch for head bobbing. That indicates forelimb lameness. The head lifts when the painful leg bears weight. Look for hip sway, toe dragging, or avoidance of putting full weight on a limb. Many arthritic dogs show pronounced stiffness after sleeping or in cold, damp weather that improves with gentle movement as joints warm up. This warm-up phenomenon strongly suggests osteoarthritis. Subtle pain signs include reluctance to be touched in certain areas, sleeping more, decreased enthusiasm for previously enjoyed activities, changes in facial expression like tightened brow or squinting, or unusual vocalizations.
If your dog takes NSAIDs like carprofen or meloxicam, anti-inflammatory supplements, or pain medications like gabapentin, document whether symptoms improve and watch for side effects, vomiting, diarrhea, decreased appetite. Pain management has been one of the toughest learning curves in my own pet care journey. Guinea pigs hide pain instinctively. It's a prey animal survival thing, so I've learned to read incredibly subtle signals. Dogs are somewhat more obvious, but still, they're stoic creatures who'd rather push through discomfort than complain. You have to advocate for them by noticing what they won't tell you. Dental health maintenance and monitoring deserves its own focus because oral disease doesn't just affect the mouth, it seeds bacteria throughout the bloodstream, damaging heart valves, kidneys, and liver over time. Most senior dogs need professional cleanings under anesthesia every 1 to 2 years to remove calculus below the gum line, though frequency depends on breed. Small dogs accumulate tartar faster, diet, and at-home care consistency. Before any dental procedure, senior dogs need updated chemistry panels, complete blood count, and potentially ECG or echocardiogram to ensure safe anesthesia. Age itself isn't an anesthesia contraindication, but undiagnosed disease is. Daily toothbrushing with enzymatic paste provides mechanical removal of plaque before it mineralizes into tartar, preventing periodontal disease progression. Aim for 30 seconds per side using pet-specific toothpaste, never human formulations containing xylitol. That's toxic to dogs. Dental-specific chews and water additives work if they bear the Veterinary Oral Health Council seal of acceptance. Those have demonstrated efficacy in reducing plaque and tartar, though they supplement rather than replace brushing. Check for fractured teeth, especially the large carnassial teeth in back, exposed roots indicating recession, or loose teeth that create pockets where bacteria thrive and cause painful abscesses. Senior dogs develop oral melanomas, squamous cell carcinomas, and fibrosarcomas. Any new growths, asymmetric swellings, or bleeding from the mouth warrant immediate veterinary examination. While dog breath is common, genuinely foul odor, different from normal canine mouth smell, indicates active infection, necrotic tissue, diabetic ketoacidosis, or uremic breath. I'll confess that I initially underestimated dental care importance until one of my guinea pigs developed a dental spur that prevented proper eating. The emergency filing procedure wasn't cheap, and the whole thing was preventable with better monitoring. Teeth matter for every species. Now for cognitive function and mental enrichment. Your senior dog health checklist isn't complete without mental health considerations. Cognitive decline in senior dogs, canine cognitive dysfunction, or dog dementia, affects an estimated 14 to 35% of dogs over age 8, with prevalence increasing significantly after age 11. Increased accidents indoors, especially in previously reliable dogs, can indicate cognitive dysfunction, urinary tract infections, kidney disease, or diabetes. Distinguishing the cause requires veterinary workup. Note if your dog paces at night, seems awake and alert at 2 a.m., sleeps excessively during the day, or shows reversed day-night patterns, sundowner syndrome. Watch for decreased interest in greeting family members, withdrawal from previously enjoyed social activities, confusion about household members, or increased clinginess and separation anxiety. Getting stuck in corners, standing on the hinge side of doors, forgetting the location of food bowls, or failing to navigate familiar rooms suggests cognitive mapping problems. If your dog suddenly forgets previously reliable commands, doesn't respond to their name, or seems confused about familiar routines, cognitive decline may be progressing. Mental stimulation through scent work, gentle training sessions, food dispensing toys, and novel experiences supports cognitive health. The use it or lose it principle applies to canine brains too. Your veterinarian may recommend selagelene, brand name Anapril, which increases dopamine levels and shows modest benefit for some dogs with diagnosed cognitive dysfunction, or dietary supplements like SAM-E and phosphatidylserine. Watching mental decline is heartbreaking. There's no sugarcoating it. But environmental management, routine consistency, and gentle enrichment genuinely help maintain quality of life longer than doing nothing. Even when my guinea pigs enter their senior years, around 4 to 5 for cavies, I notice they appreciate familiar routines more and startle more easily at changes. Stability becomes comfort. Let's discuss preventative care and vaccinations. Your senior dog health checklist should include a conversation with your veterinarian about age-appropriate vaccination protocols. Not every dog needs every vaccine annually into old age. Measuring antibody levels for distemper and parvovirus tells you whether your dog still has protective immunity, potentially eliminating unnecessary vaccines in seniors with adequate titers. This is called titer testing. While rabies is legally mandated, some jurisdictions accept exemptions for senior dogs with documented health conditions that make vaccination risky. Discuss options with your vet if your dog has immune-mediated diseases. Leptospirosis, Bordetella, canine influenza, and Lyme vaccines should be evaluated based on exposure risk, boarding facilities, dog parks, tick-endemic areas, rather than given automatically. Monthly heartworm, flea, and tick preventatives remain essential throughout your dog's life. Senior dogs are not immune to parasites and may be more susceptible to complications from infestations. Even dogs on regular preventatives can harbor hookworms, roundworms, whipworms, or giardia. Annual fecal testing catches infections before they cause clinical disease or zoonotic transmission to humans. Antioxidants, including vitamins E and C, beta-carotene, selenium, and omega-3 fatty acids, support immune function that naturally declines with age. Sensory decline affects how your senior dog navigates the world. Your checklist should track these changes and accommodate them. Set up unfamiliar furniture arrangements in dim and bright lighting to see if your dog navigates confidently or bumps into objects, indicating vision loss. Nuclear sclerosis, normal age-related lens cloudiness, doesn't significantly impair vision, but true cataracts appear as dense white opacities that may eventually require surgical removal for functional blindness. Clap behind your dog when they're not looking. Use high-pitched and low-pitched sounds separately. Dogs often lose high frequencies first, and watch whether they startle when you approach from behind. Keep furniture arrangements consistent. Use nightlights to help dogs with poor night vision. Approach deaf dogs from the front, where they can see you. Use vibration collars or stomping for attention. The sensory decline progression reminds me of watching my oldest guinea pig, Whiskers, lose his hearing around age 6. He stopped responding to the treat bag rustle, but still weaked at the sight of vegetables. Dogs adapt remarkably well to gradual vision and hearing loss. It's the sudden losses that disorient them. Weight and body condition management is crucial. Your senior dog health checklist must include monthly weight tracking and body condition scoring because both obesity and unintentional weight loss signal problems. Establish baseline weight during health and track changes. Losses of 10% or more over 2 to 3 months warrant investigation for cancer, kidney disease, diabetes, or hyperthyroidism. You should feel ribs easily under a thin fat layer without pressing hard, see a waist when viewed from above, and observe an abdominal tuck when viewed from the side. Anything less indicates overweight or obesity. Run hands over the spine, hips, those are iliac crests, and skull. Visible bones with no muscle coverage indicate muscle wasting, called sarcopenia, even if overall weight seems stable. Excess weight exacerbates arthritis, increases anesthesia risks, predisposes to diabetes mellitus, causes respiratory compromise, and shortens lifespan. It's the most common preventable disease in senior dogs. Weight management feels like a constant balancing act. I get it. My guinea pigs are chunky little potatoes who'd happily eat themselves into obesity if I let them. But carrying extra weight genuinely impacts quality of life when joints already hurt and hearts already work harder. Laboratory value baselines and trends matter. Numbers tell stories. Establishing baselines in healthy senior years helps identify concerning trends early. Creatinine and BUN, blood urea nitrogen, rise as kidney function declines, but values must increase substantially before appearing abnormal on standard ranges. Tracking trends catches problems earlier. Alkaline phosphatase, or ALKP, often increases with age, Cushing's disease, or certain medications. Persistently high values, especially with concurrent clinical signs, warrant further investigation, including bile acid testing or ultrasound. Anemia, low red blood cells, thrombocytopenia, low platelets, or leukopenia, low white blood cells, can indicate bone marrow disease, immune-mediated conditions, or chronic disease processes requiring additional diagnostics. Fasting blood glucose should remain between 70 and 120 milligrams per deciliter. Consistently elevated values above 200, plus glucosuria, glucose in urine, confirm diabetes mellitus diagnosis, requiring insulin therapy. Total T4 below normal range suggests hypothyroidism, but sick euthyroid syndrome, low T4 from non-thyroidal illness, complicates diagnosis. Additional testing with free T4 and TSH may be needed. Sodium, potassium, chloride, and phosphorus imbalances indicate kidney disease, Addison's disease, or medication side effects that require management adjustments. Understanding blood work has definitely been my learning curve, both for guinea pigs and now researching dogs. Those reference ranges exist for a reason, but the trends within normal often tell more than single values. Vets worth their salt explain what numbers mean, rather than just saying everything's fine. Now we arrive at the hardest part of any senior dog health checklist: end-of-life planning and quality of life assessment. Preparing for the inevitable while maximizing remaining good days. Avoiding this conversation doesn't make it easier when the time comes. Use objective assessment tools like the HHH-MMM scale, that's hurt, hunger, hydration, hygiene, happiness, mobility, more good days than bad, to track whether your dog still experiences more positive than negative moments. If pain medications at maximum safe doses no longer provide relief, if your dog can't rest comfortably, or if they vocalize frequently in distress, quality of life has declined significantly. Dogs who can no longer stand without assistance, have lost bowel and bladder control entirely, or cannot reach food and water independently, may have crossed the threshold where dignity outweighs longevity. Talk about what interventions you would or wouldn't pursue: CPR, hospitalization, feeding tubes, intensive care. What quality of life non-negotiables exist? How you'll know when it's time. Some veterinarians specialize in end-of-life care, providing at-home support focused on comfort rather than cure, including pain management, sedation for anxiety, and guidance through the final weeks. Many veterinarians offer peaceful, at-home euthanasia in your dog's familiar environment, allowing them to pass surrounded by family rather than in a clinic. Discussing logistics ahead of time reduces stress when the moment arrives. I won't pretend I have personal experience with this. My guinea pigs are still youngish, but I've watched friends navigate these decisions. And the common thread is always they wished they'd talked about it sooner. Having the conversation while your dog is still happy gives you framework for recognizing when they're not anymore. Here's your condensed senior dog health checklist for quick reference. Every 6 months, you need a complete veterinarian examination with blood work, urinalysis, thyroid testing, blood pressure, dental evaluation, and professional cleaning as recommended, weight and body condition score documentation, and updated pain assessment and medication review. Monthly, do a home weight check, comprehensive lump and bump body palpation, nail trimming as needed, and documented mobility assessment. Weekly, do an oral health quick check covering gums, teeth, breath, and thorough coat, skin, and paw pad inspection. Daily, monitor appetite and water consumption, elimination habits, gait and mobility, behavioral and cognitive function, and pain behavior recognition. Let me address a few common questions. How often should senior dogs see the veterinarian for checkups? Senior dogs should visit the veterinarian every 6 months rather than annually. Aging dogs experience physiological changes more rapidly, and conditions can progress quickly between yearly appointments. Twice annual examinations with blood work, urinalysis, and physical assessment catch organ dysfunction, cancer, and metabolic diseases in earlier, more treatable stages. What are the most important blood tests for senior dogs? The most critical blood tests include a complete chemistry panel measuring kidney function, BUN and creatinine, liver enzymes like ALT, AST, and ALP, blood glucose and electrolytes, plus a complete blood count assessing red and white blood cells, along with thyroid function testing and urinalysis. These baseline values, tracked over time, reveal developing organ disease, diabetes, hypothyroidism, anemia, and infection before clinical symptoms appear.
When is a dog considered a senior, and how does that vary by breed size? Dogs are generally considered senior when they reach approximately the last 25% of their expected lifespan, which varies significantly by size. Giant breeds, like Great Danes, become seniors around age 5 to 6. Large breeds, like German Shepherds, around age 7 to 8. Medium breeds, like Beagles, around age 8 to 10. And small breeds, like Chihuahuas, around age 10 to 11. Larger dogs age faster and have shorter lifespans due to accelerated cellular aging and increased cancer rates. This senior dog health checklist probably feels overwhelming. Trust me, I get it. When I first started creating care schedules for my guinea pigs, the sheer volume of daily, weekly, and monthly tasks seemed impossible to maintain. But here's what I learned. Checklists aren't about perfection. They're about creating sustainable routines that catch problems early when they're easier and cheaper to address. Your senior dog isn't asking for perfection either. They're asking for attention to the details that make their golden years comfortable rather than painful. The twice-yearly vet visits, the daily observations, the nutritional adjustments, the mobility monitoring, none of it reverses aging, but all of it maximizes the quality of whatever time remains. And honestly, that hands-on daily monitoring becomes precious time together. Those moments checking paws and running your hands along their body, noticing the new gray hairs on their muzzle, watching how they rise from their bed, that's not just healthcare. That's love expressed through attention. Your senior dog has given you years of companionship. This checklist is how you return the favor.
Thanks for listening to this episode of Total Pet Parent Podcast. New episodes come out every Monday, Wednesday, and Friday, so there's always something fresh waiting for you. If you found this episode useful, I'd really appreciate it if you could leave a 5-star rating and write a quick review. It honestly makes a huge difference in helping other pet parents find the show. And if you haven't already, hit subscribe or follow so you get notified the second a new episode drops. I'll see you next time.